Just a point to note, Honourable Speaker, with regards to the question, if I can put it in order, it's not to replace the new rehabilitation centre is not to replace the current Twomey Hospital, but rather to replace the old Tamavua military hospital, former military hospital, or the former Tamavua rehab facility. Current progress, Honourable Speaker, sir, the construction of the new National Rehabilitation Centre has been approved by the Government of Fiji and the Government of Korea. Last year, Cabinet approved a subsidiary arrangement between the Ministry of Health and Medical Services and the Korea International Cooperation Agency to establish Fiji's National Rehabilitation Centre. As per the agreement, KOICA will provide a grant in aid of not more than 10 million, which is approximately 22.2 million Fiji dollars. And therefore, we are grateful to KOICA and to the government and to the people of Korea for their generous assistance. So most of the Tamavua Hospital has been assessed to be non-compliant with OHS requirements from the non-maintenance of the aging buildings and facilities that were built many decades ago. So although we have experienced some delays in finalizing the relocation of all services currently offered at the old Tamavua Hospital and the clearance of utilities servicing the hospital, the Tamavua Hospital team and the Ministry's Assets Management team have been working closely with the Ministry of Works and KOICA Fiji's office in the last 10 months to ensure that the site is ready for the KOICA construction team anticipated movement into the site in January of 2025. So further to that, a health partner, the Latter-day Saints Charities, has also indicated it, and its willingness to assist in funding more than 300,000 required for temporary relocation of the rehab hospital to the Twomey Hospital for the duration of the construction, again, which the Ministry is grateful for. And government has allocated funding of 400,000 in this financial year for the demolition and preparation of the hospital site for the new rehabilitation hospital, Your Honourable Speaker, sir. Meanwhile, other preparatory activities have been undertaken and are ongoing, and they include the first in-country training by rehabilitation medicine experts from the Korea University and Korea Rehab was conducted in April this year. The second in-country training is planned for January next year. There's an invitational training program and is also planned where 7 to 8 health professionals from Fiji will be traveling to Korea for on-site training at a Center of Excellence in Korea. So the project team is also expected to be traveling to Fiji later this year for ongoing discussions with KOICA, Fiji office team, and the Ministry's team, and the project designers as we continue our preparation for this very important project, Honourable Speaker, sir. So the detailed design phase is anticipated to be completed in September of this year, and the process of tendering of project will subsequently follow in October 2024. That is my question to the Honourable Rabanowski.